But we begin tonight with Dr. Ben Carson. Dr. Carson, thank you very much for being here. So, I'm interested to speak with you about this concept of reopening the country, because you are a medical doctor, a surgeon, and also the HUD Secretary concerned with housing and urban centers in this country. So where do you have to be as both of those, wearing both of those hats, to look towards a May 1st reopening of the U.S. economy?
Well, they're not incompatible hats. What we have to recognize is that there are benefits and risk in life. And that's why we have these very complex brains. And we can take all kinds of information, integrate it, and come out with a logical solution. It requires looking at data and understanding how to analyze it, looking at what's happened in other countries. So when we see that bell-shaped curve, and we've seen it come down rather steeply in some other countries, when that happens, we haven't seen it go back up. So that's what we're looking for here. That already seems to be starting. Obviously, we don't want to go too early. We'll wait for a couple of weeks and see that it continues down. And then we also need to make sure that we have appropriate testing. We have to be able to test people to see if they have the virus. We have to be able to test people to see if they have the antibodies, which will make them much safer in terms of returning to the workforce. And then we have to return them in a logical way, That's the key.
So I want to show you some of the new polling that we have tonight that we just got back that I think sort of gives you a little sense of where the American public is in terms of their confidence levels with all of this at this point. Are you concerned about catching COVID-19? 76% of the country says that they are still concerned about getting it. This is April 4 to April 7. Only 24% are not concerned. Take a look at this next one. 75% of the country is concerned about being able to get tested. And we heard a lot of questions on this tonight. I think this is really one of the sort of anxiety-raising issues that still persists in the country. People want to know whether or not they had it, and they want to be able to have a quick, easy way to find out. And this last one I find very interesting. Do you know someone with coronavirus? Only 21% of the country says yes, they do. 76% says no, they do not. Living here in the New York area, I think everybody knows somebody with this terrible virus. But in the rest of the country, the numbers are much lower, Doctor. Your thoughts on all of that in terms of how they paint the American public right now?
Well, keep in mind that a lot of people who have the virus are completely asymptomatic, somewhere between 25 and 50%. So you probably do know someone who has it. You may have it. Who knows? But, people have been terrified because, we've talked about the bad. One of the things we don't seem to talk about a lot are the number of people who have recovered, which is going to be about 98% of all the people who get it. They're going to do quite well. And we need to really start talking that up and start talking about what we can do, not how we're going to be harnessed. Because the fact of the matter is, if we destroy the economic infrastructure of our country, we're going to lose a lot more people than we lost from this virus. So we can't, operate out of hysteria. When people are hysterical, they don't do logical things.
Yeah, I think it's interesting that more people are concerned about the economy than they are about getting the virus. I thought that was a pretty telling number as well. I want to play this from Governor Cuomo because it speaks to your work as HUD Secretary and some of the communities that you deal with. Let's watch this.
We're going to be doing more testing in African American and Latino communities. With more data, we're going to open new testing sites, primarily in African American and Latino communities.
How concerned are you about the numbers that we're seeing in African American and Latino communities and in the urban centers especially?
I'm very concerned about it. I was concerned about it a long time before this because of a lot of the health disparities that occur. And in this case, it's particularly concerning because people who live in close proximity and people who cannot shelter at home are people who are more likely to contract the disease. So it will attack anyone. And then when you throw on top of that, a higher incidence of some of the underlying conditions like hypertension and diabetes, obesity and asthma, obviously you're creating a situation that is very undesirable. What people should know is that in the last flu epidemic, last year, and the one before that, and the one before that, and the one before that. The same demographics, blacks and Hispanics, had higher mortality rates because the same things were going on. At least now, I think people are going to pay attention to it, and maybe we can address it.
Yeah. Before I let you go, last question. You know, it's interesting when you look at the numbers. You just mentioned the flu. In 2018-19, 2017-18, it was a very big flu season. We lost in the United States 61,000 people from the flu. Now the models that we're showing is showing a similar number for COVID-19. Why do you think that is? And, you know, what's your takeaway from that?
Well, you know, that's a question that I've asked many virologists and epidemiologists, and I get lots of different answers to that. Why has this one gotten so much more attention than other flus? Well, for one thing, it's very, very contagious. And for another thing, you know, this is a pandemic. It's everywhere. So your likelihood of getting it is greater. But, you know, it could be that sometimes we overreact to things. The important thing is that we sit down and we try to analyze it logically. That's what's been done. That's what the task force is there for. That's why we consult with multiple experts around the country at various universities and research institutions and try to get the very best data and use that to make recommendations.
Dr. Ben Carson, always good to talk to you. Thank you very much, Secretary of Housing and Urban Development.
Thank you, Martha.
Thank you, sir.